Okay, getting into our first major section of muscles, we're going to focus on the axial muscles. So looking at the muscles we find in the head, the neck, and the back. So we're going to identify the muscles we find in these regions. We're also going to talk about the movements and the function they perform as well. So let's start with the muscles that help you create your facial expressions. So these are ones that are involved with you being able to smile, frown, and make all sorts of facial expressions with your face. So let's talk about some of these. Now keep in mind from the last video we talked about how muscles are named, so there's information hiding in these, and we're going to talk about some of that as we go through these. So the occipitofrontalis, sometimes you'll hear these called the fronto-occipitalis or the occipitofrontalis, or even separate. You might see frontalis and occipitalis. All of those are talking about the same thing. I know that one's a little confusing, but if you see any of those combined, right, any of those, and you know what we're talking about where, right, because they're named for the cranial bone that they are covering. The corrugator supercilii, so think corrugated, like a corrugated cardboard. This is so that you can furrow your brow. The orbicularis oculi, remember orbicularis, it's round, it's a circular muscle. Oculi, oculus, the region, right, so this is a circular muscle around the eye. The back side of the occipitofrontalis, the occipital belly, meaning it's just the end that is on the occipital side. The orbicularis oris, so similar to the orbicularis oculi, a round muscle, a circular muscle that is around the mouth, right? Oris, we think oral like the mouth. And then the buccinator, which is going to be the cheek. When it comes to the eyes, because the eyes have a lot of movement, right? We use them to look around and to create some expressions, right? You can roll your eyes, you can squint, things like that. We have various muscles that help move the eyes around. So let's go ahead and talk about some of these. I'm going to start over here on the right, the anterior view. So we're looking head on that eye. So we have the superior rectus. Remember, superior is above, and rectus we think straight. So this one's going to go straight back. If we're looking here, it's this one at the top of the eyeball going straight back. We have the superior oblique. Now we cannot see this one on the lateral view really, not very well. You can kind of see it here, but this one's going, if you notice, it's going side to side. Remember, rectus and oblique is telling us the direction of the muscle fiber, so oblique is going at an angle. We have the lateral rectus, so straight back, right, straight back on the lateral side, so this is towards the temple, right, this is the side that's closer to the temple. The inferior oblique, right, we have down here, we see it wrapping around. The inferior rectus, the one that's running straight back on the bottom, and then the medial rectus, which we see on the other side. We've cut away part of the lateral rectus here to see the medial rectus. This is what on the side that's going to be closer to your nose, right? The medial is going to be towards the midline, right? So we're looking at what direction we're looking, right? It may be one muscle, it may be a combination. So like looking straight up, right? Superior rectus and the superior oblique are going to work together. Versus looking at some of these other angles, it's just one or the other. Straight down though, we see a combination of the inferior rectus and the inferior oblique working together. And then this one that we don't see over on the right here that we see on the left side of the slide here is the levator palpebrae superioris. If we break this down, levator, if you levitate, right, think lift, we're lifting something upward. Palpebrae superioris, we're on the top side. This is going to be the muscle that is going to raise the eyelid, right? So when you open your eyes, you raise that eyelid. The levator palpebrae superioris is the one that is going to help with that. So a lot of muscles involved in the eye, but they're named for their locations and the direction of the fibers. So if you're looking at the model, you remember the terminology and you remember the general terminology, the muscles are not too hard to figure out here. All right, let's look now at the muscles that move the lower jaw. So for you to be able to open and close your jaw, we have the temporalis, named because it's over the temporal bone. The masseter, right? Mastication is the, I guess you say, official term for chewing. So you can imagine what the masseter muscle is going to help with. If we cut some of these muscles away, right, we go deeper in, right, so this is where we're like on that, we're attaching to that sphenoid. If you remember the pterygoid plates, right, the lateral and the medial pterygoid plates, right, we have muscles that can attach to those. So we have the medial pterygoid and the lateral pterygoid. So both of these muscles here are going to attach to those pterygoid plates, right? And these ones, same thing, are going to have, they're going to provide assistance in your ability to chew. So they're going to help with things like the elevation, so lifting your jaw, so closing your jaw, right? Elevation, and protrusion, being able to push it forward. Keep in mind too, this is the first time we're also bringing up superficial versus deep muscles. There are a lot of muscles. Most of the muscles you've probably learned about in a previous class, if you learned about any muscles, were superficial, meaning the ones that are closest to the surface, the ones kind of just right underneath the skin and fat and whatnot. Versus the deep muscles, these are going to be much deeper in. They're further into the body, right, in towards the middle. Those are ones that are probably newer for you guys. But I wanted to make that distinction between superficial and deep, because those terms we may have heard of but maybe don't remember, or maybe they're brand new. So just keep that in mind. Superficial versus deep, we're talking about how far into the body are we going? Is it close to the surface, which is superficial, or are we much further in? Are we a deep muscle? Now let's look at the muscles that help move the tongue. So if we're looking at the tongue, we have the genioglossus, this big one here, right? It's going to connect kind of the bottom of the tongue, the inferior side of the tongue, and connect to that mandible, right? We have the styloglossus, which is attaching to that styloid process and the tongue. We have the hyoglossus, which is attaching from the tongue to the hyoid. Those are the ones that I'm going to care about. And you notice they're named for the things that they connect, right? Hyoid to the tongue, styloid process to the tongue, right? So we're named based on what we're connecting to. I'm not as worried about the ones over here, but you should be able to look at these. And you'll see a model with some of these muscles, as well as some pictures of these muscles in your lab. Moving down, we get into the anterior side of the neck. So right here we're seeing the inferior edge of the mandible, so this would be like the bottom of someone's chin. We see the styloglossus. In part, we see the geniohyoid, right? We see the mylohyoids right here and here. Those are both the same thing. The stylohyoid, hyoid. Here's the hyoid bone. Remember, this is one that does not articulate with any other, so just muscles and ligaments and whatnot are connecting with, and tendons are connecting to it. And then moving down, right, when we'll get into some of these pieces later. So here we're seeing a peak of the larynx and the trachea and the thyroid. Back here in this gray and yellow. We're not going to worry about the individual structures of that, but just keep in mind there are muscles that wrap over it, and a lot of them are named for what they connect to. So like the thyrohyoid, right here, kind of going down past that thyroid up to the hyoid, the omohyoid, the sternohyoid, so sterno, right, and sternothyroid, we think from the sternum up to the hyoid bone or up towards the thyroid. And the rest are down here, the clavicles, the sternum, the scapula, that should all be a review. If we look at the lateral and the posterior views of the neck, we see the sternocleidomastoid, which is again named for what it's connected to. So connecting to the sternum, connecting to the clavicle, and connecting to the mastoid process. The levator scapulae, levator, remember levator tells us an action, that tells us we're raising something. Scapulae, we think scapula, so this is going to help us raise, right, the scapula, the shoulder blade. The trapezius is this big, like triangular piece, and there'd be another one on this side. On the right side, we've cut away those superficial muscles So this trapezius would go all the way across, including onto the right side here. This is going to help kind of create part of your shoulder. It's going to attach onto the scapula, onto the acromion process. We have the scalenes. So on this side here, so again on the left side we have like the superficial, like the trapezius. On the right side we've removed that trapezius. We can see that levator scapulae again. See how it comes down, it can raise that shoulder blade. And then over here, right now we're getting really deep, right? So we've gotten way deep. We have the suboccipital muscles, so below the occipital bone, right in the neck. The splenius capitis, which has been cut away. The longissimus capitis, capitis we think head, right? The semispinalis capitis, right? So connecting head downward. And if we continue with this, right, some of these, again, are pictures we've already seen, like these top two. So just remember, like levator scapulae, right, the splenius, the trapezius, the sternocleidomastoid, right, coming down here. Some other ones we haven't seen yet. So here's our splenius capitis, kind of connecting to from the back of the skull to the cervical vertebra. The splenius cervicis, we think connecting in that neck region. Right, and so these two muscles are going to help with things like flexing and rotating in your neck, supporting your neck, as well as some lateral movements to the side with the splenius cervicis. We have the rhomboides minor and rhomboides major. You see them coming off of those vertebrae towards the scapula. And so those can help pull that scapula in towards the midline. And then moving down, we have all of the deep muscles found in the back. Some which originate up in the neck and move their way down. So if we are taking a peek, we have the semispinalis capitis, which is joined with the spinalis, the deep spinalis capitis, the longissimus capitis, the ilicostalis cervicis, the ilicostalis thoracis, longissimus thoracis, ilicostalis lumborum, right, named again for a lot of regions. So a lot of things are named for the regions that they are found in. And ilico, right, we think what else could we be attaching to? Right, so if we trace them down, right, ilicostalis lumborum, right, we see we're in the lumbar region, but we're also reaching onto that ilium of the hip. The semispinalis thoracis here, the spinalis thoracis, which is like in the middle. So you see like the semispinalis are like off to the side, whereas spinalis is kind of like more towards the center. Now the longissimus muscles we're talking about with the ilicostalis lumborum, the ilicostalis group and the longissimus groups, as well as the spinalis groups. These ones are also called long muscles in the back, because if you notice, they span kind of the length of the entire back, or really close to it. So these guys, sometimes together, are called the erector spinae muscles, all together. And so these guys are going to help with the lateral flexion of the spines when it's acting unilaterally, and then to extend the spine when we're using bilateral. So if one of side is contracting, it's going to allow us to kind of bend over towards the side. So if you were standing straight up, and then while you're still standing, you were to kind of tilt and bend your back up towards the side, like towards the left or right, that's what these muscles can help with if one side is contracting. If both sides are contracting, this is going to pull you back, right? So you're going to flex backwards or extend backwards in the back. So you'd be like reaching up and back behind you, like if you were trying to do a back bend. We also have the rotator brevis, the rotator longus, and the short rotators. Those are found on those transverse processes, and it's going to help you with rotation, right? So remember, turning along a single pivot point, so rotating the vertebra individually. So when one of those sides is contracting, it's going to allow you to rotate towards the side that is contracting. All right, getting to the muscles found in the abdominal wall and the thorax. We're going to talk about these muscles in more detail, get into some other ones that we find in the front, around the abdominal wall, and in the chest. So let's look at some of the big ones first, mainly looking at some of the superficial ones, but we'll look at a couple deep ones here as well. Some may sound familiar, like pectoralis major, the big muscles we would see in the chest, the latissimus dorsi, which is kind of on the back end there, and that's going to be a major help for pulling back and down. So if you're trying to pull something from up above you and pull it down towards you, your latissimus dorsi would help with that. The anterior serratus muscles, if you notice the name anterior serratus, they're anterior, they're in the front, and if you see them, they kind of looks like, think of like a serrated knife, right? Like if you have a steak knife, it's serrated. It has that kind of like jagged edge. Anterior serratus has that appearance. The external obliques, remember that's just on the name of the angle. Everything here in white, up in here kind of in the front, is called the linea alba, alba meaning white. This is just the sheath that's kind of covering the muscles underneath, namely the rectus abdominis. If we go deeper, right, so we're cutting away part of the external oblique, right, we cut that away, we cut away some of the linea alba, we reveal the rectus abdominis, so those ones are running straight up and down. We see the internal oblique, which runs perpendicular to the external oblique. And then if we go even deeper, we have the transverse abdominis, so they're running these transverse abdominis muscle fibers are running perpendicular to the rectus abdominis. Going down, right, so seeing this like in the lower back and pelvic region, we see the quadratus lumborum, right, and so those are attaching to the ilia of the hips. We see the psoas major here on each side, the iliacus. Right, and see how they're kind of coming down. They're actually, this one's coming down, right, the iliacus and the psoas are coming down over across and actually attaching onto the femur. If we look at the diaphragm, now the diaphragm is a bit of a, I guess you could say, a strange one. This is the muscle that is responsible for helping us breathe. So this muscle, when it's relaxed, it forms like a really soft upside down U or bowl shape. When it's relaxed, when it contracts, it's going to move down and flatten out. And that's what's creating the space for our lungs to really expand when we inhale. And let's look at the thing with the diaphragm, though, is it's separating out the thoracic from the abdominal cavity, but we have tubes, right, namely the esophagus, that needs to run through that space, right? It needs to run through from the thoracic cavity to the abdominal cavity, right? So the esophagus is one, the vena cava and the aorta all have to pass through that. And so we have various openings, right, passing through. We have the caval opening, which will let the vena cava through. We have the aortic hiatus, which is what the aorta will pass through, and then the esophageal hiatus, where the esophagus passes through. And so we see that this is kind of attached right at that bottom, that last rib, the 12th pair of ribs, right? Here is the quadratus lumborum in the back, right? So here's the spine, right? Here is the sternum. So this is a person that, if we're looking at them, they'd be facing up and lying on their back. We're looking at this person from the bottom up, so we're looking at them from the abdominal cavity up towards the thoracic cavity. If we look at the intercostal muscles, we have 3 layers. We have the external intercostal, the internal intercostal. You'll notice those muscle fibers run opposite of each other. The innermost intercostal runs straight up and down. We also have the serratus anterior, which kind of runs alongside and around on those ribs, right, just above the external intercostals. Right? And then the pectoralis major, which has been dissected away, right, is going to be the major chest muscle, right, that we see. There is a pectoralis minor, which is down here attached to the ribs underneath the pectoralis major. The intercostal muscles play an important role in allowing you to breathe as well. So I mentioned the diaphragm on the previous slide is going to move down and flatten out to increase the volume in the thoracic cavity so your lungs can expand. The intercostal muscles will also help with that, in that they will help move the ribs up and out to create even more space inside the thoracic cavity and allow even more expansion of the lungs. Right, so you do these actions and it increases the space inside of the chest cavity. It allows for air to rush in and expand those lungs. And then when these muscles relax down, right, the ribs move down and in, the diaphragm moves up and curved, it's going to create a smaller space, and that's when you would exhale. Looking down at the pelvic floor, so this is a superior view, so we're inside the kind of like abdominal cavity looking down into the pelvic area. We see the pubococcygeus. So you think about what they're named for, right? Pubo, we think we're connected to the pubic bone, right? Coccygeus, we think the tailbone, right? So those muscles are named for what they'll connect to. The iliococcygeus, which is connecting the ilium to the coccyx. And together we can call these the levator ani. So it's kind of, remember, lift, right? Levator, we're lifting something. And then looking over here, we have various openings, so like the urethral canal, so that the urethra can get out so someone can urinate. We have the rectal canal, which is going to be so that we can defecate. And then for those who are assigned female at birth, generally will have a vaginal canal as well, which is only in those who have that, who are assigned that, generally speaking, for the vaginal canal to exit through. So if you notice, that means for a male, they would have the urethral canal and the rectal canal, but they would not have that vaginal canal opening. And that means so for females, there's 1, 2, 3 openings, right, instead of just 2. And the iliacus, right, is going to be back here, connecting those iliac crests. If we look from the inferior side, now depending on if someone has a penis or a vagina, they'll have a slightly different setup. Generally, the muscles are all the same, just slightly different arrangements to make up for the difference in anatomy. We have the ischiocavernosus, which is right here, kind of forming this little like a V shape. The bulbospongiosus, sometimes called the bulbocavernosus, right, which is right kind of wrapping around for like the penis is going to kind of wrap around with that penis, or in the female anatomy, right, we're looking at one's kind of wrapping around the urethra, the vaginal opening. We have the transverse perineal muscles. Remember, transverse, we're going kind of laterally side to side, so these ones are going to connect side to side. The anus, the external anal sphincter, so this is a muscle that would wrap around the anus, right? You can, it's kind of hidden by ligaments here in the female side, but what this is going to do is going to give you some control over, like if you were to use the bathroom, this would give you some conscious control over that. The levator ani, which is again surrounding that. And then back here, that's where we see the tailbone. And the gluteus maximus, which is going to be the biggest muscle, the largest one we see making up the buttocks.